Hi, this is Carissa Karamanis O'Brien coming to you from EMS World Expo in Las Vegas, Nevada. We're here in the Sudden Cardiac Arrest Foundation podcast studio, and I'm with Dr. Ben Bobrow. Welcome.
Good morning.
So tell me a little bit about sudden cardiac arrest and how it really impacts our community.
Sure. So sudden cardiac arrest is a leading cause of death in our country. Somewhere around 300,000 sudden cardiac arrests every year. I can tell you in Arizona, we have about 5,000 sudden cardiac arrests every year. Truly, it's a tragedy, and it's a terrible, terrible disease. Lots and lots of people die abruptly at a young age, and so certainly lots of things that we can and need to do to combat that.
And really, there's a little bit of education, I think, to be had as far as understanding the difference between heart attack and cardiac arrest, and the fact that risk factors are a little bit different. It really can happen to anyone at any time, right?
Exactly. Cardiac arrest can be related to heart attack, but it doesn't always, and doesn't have to be. In fact, lots of people, even young people, have sudden cardiac arrest for other reasons besides heart attack, and it's really just a tragedy when we have really young people, teenagers, die from sudden cardiac arrest.
So some of the keys to helping to increase survival is really a little bit about preparedness, right? Being aware and then being prepared in the event that a cardiac arrest happens. How can communities and really EMS help to bridge that gap in education for the community?
Yeah, you hit the nail on the head. The awareness is really the key. Cardiac arrest can happen anytime in any place, so it's difficult to predict. So that means that you really have to be prepared. For example, in your community, in your school, in your workplace, people have to understand what cardiac arrest looks like. And I'll just tell you, basically, if someone has a sudden, unexpected collapse and they're not breathing normally, and what I mean is if they're gasping, that's not normal breathing, you have to assume that person's actually in cardiac arrest, and you have to be able and willing to do three things. You got to call 911, you got to begin CPR, and if there's an AED there, you have to get it or have someone get it for you and try to use it.
Can you talk a little bit about the new guidelines and what that really means for CPR?
Sure. So the new guidelines, specifically the new 2010 AHA guidelines, are really one of the novel things. They really say that bystanders, lay rescuers, if they're not previously trained and not really interested or willing or able to do compressions and rescue breathing, should just do what the Heart Association calls hands-only CPR. So if they see an adult suddenly collapse and not breathing normally, they should start hands-only CPR. And kind of the hope is that will get more bystanders to act, to do something. And that's really what we need, because what we know is that a majority of the time, probably 70-ish% of the time, depending on where you are, we don't get any bystanders to do anything. And that's really that's our real problem. So one of the concepts is that hands-only CPR will get more bystanders to jump in and act and do something. We think that, we're pretty confident that will actually produce more survivors, a lot more survivors around the country.
So EMS really has a crucial role in making sure more members of the public are aware of that, so it actually does increase their action, right?
So EMS has a lot of different roles in this. I think what you're talking about is sort of the public awareness role. This is a great message. Hands-only CPR is a tremendous message for EMS agencies, for example, municipal fire departments, to get out to their community. And I've seen them do it all. Certainly in Arizona, they've done a phenomenal job. And so they can teach the public what cardiac arrest looks like, and can get the public to do CPR to a certain extent. Really, to get to the next phase, I really think what EMS needs to do is to have a really well-structured dispatch-assisted CPR program where they actually measure how dispatchers give CPR pre-arrival instructions. And when they start focusing on that, then bystander CPR rates can really go high, and we've seen that in several cities like Seattle. That's a major part of their program. Is their dispatch-assisted CPR program is enormously successful.
Very good. So let's talk a little bit about the Sudden Cardiac Arrest Foundation and the resource that it provides. What's really their strength in providing that connection for folks?
So I think the SCA Foundation does a great job of increasing public awareness about what cardiac arrest is, and helps communities kind of organize themselves and the resources. One of the other really important things I think they do is they try to supply resources and accurate information for cardiac arrest survivors. And after cardiac arrest, people are left with all kinds of questions about, what happened, and people have problems, issues, questions with, for example, internal defibrillators. That's just one of the many, many, many questions. And people need resources, and I think they need to talk to other people who've gone through it. And the SCA Foundation does a tremendous job of linking people up with other survivors and providing those resources, and so I think that's really important. We've been very fortunate. We set up a state virtual chapter in Arizona, an SCA Foundation chapter, and we had to do it because we had so many survivors. It was a great problem. We've had over 700 cardiac arrest survivors in the last several years, and so we now need to figure out ways to kind of help people beyond just getting their hearts restarted.
Fantastic. Well, congratulations to you. That's kudos.
Yeah, I think they have a website with some resources, sca-foundation.org. Help me.
sca-aware.org.
Thank you. sca-aware.org.
Very good. Well, thank you again. We appreciate your sharing your insights on this very important topic.
Thanks for focusing on it.
Of course. Again, this is Carissa Karamanis O'Brien coming to you from EMS World Expo 2011 in Las Vegas from the Sudden Cardiac Arrest Foundation podcast studio.